Good evening. My name is Jimmy Hoppa. I'm with WBOC and Delmarva Life. It is a privilege for me to be the moderator for this evening's discussion. There is, I think I could probably count on one hand the number of people who have escaped any kind of impact from heroin, opioids in this county. It is absolutely overwhelming. So far in 2017, if these numbers are still accurate, they may have changed by tonight, there have been 104 overdoses in Wicomico County. I'm going to let that sink in here for just a second. 104. The good news is that hope is here, that individuals can become clean and sober. Courage is needed for the grieving families and those who are struggling to seek help. And perseverance is the key to overcome loss and to live in recovery. March 1st, Governor Larry Hogan called for an opioid addiction crisis state of emergency here in Maryland. Each county charged with combating the problem locally. Wicomico County has accepted that call to action, and our county leadership wants your input for future plans. So again, thank you for being here tonight. At this time, I'd like to introduce our panel members: Wicomico County Executive Bob Culver, Acting Wicomico State's Attorney Ella Disharoon, Wicomico County Sheriff Mike Lewis. They will be answering questions here momentarily. At the moment, please welcome Lori Brewster, who is the Wicomico County Health Officer. Mrs. Brewster is going to share what is being done to address the issue locally, and then we're going to open the floor to questions and input from you and explain to you how you can get those questions to us. Ms. Brewster?
So what I wanted to do is frame the issue, why we're here tonight, and what we hope to gain out of this. So opiates have had a significant impact in our community, and I don't think that that is a shock to anyone here. We've seen a rise in criminal activity, which State's Attorney and the Sheriff will speak to. Deaths have been on the increase statewide. I will be telling you about the trend in Wicomico County, which is a positive trend. And we're seeing a huge increase in healthcare costs, not only from the addict themselves, but the family members who have stress from the individual's addiction. As Jimmy said, this is a community issue, and we want to hear what you all would like us to do. We want to hear your questions about what we're currently doing, and we understand that we can't do it alone, and we want the community to assist us. The face of the opiate user is not what it used to be. It's any of our family members, friends. It could even be one of us that could succumb to the disease. So the impact on the community, it's huge. And I'll let you read those bullet points. I don't have to read them to you. And there's probably some things that I didn't even put up there as to the impact that this epidemic is having on Wicomico County. The one thing I did want to share with you that I think is really important is that it's a $700 billion a year increase in healthcare costs. Think about that. $700 billion, that's huge. And if we could address this epidemic, we could at least make an impact there. And also, the county executive may bring this up, the tax base. When we have individuals that aren't working, they aren't contributing to our tax base, and that's a huge issue as well. So in Maryland, the total number of overdose deaths has risen steadily since 2010. There's on average 6 overdose deaths a day in Maryland. 6 people. So I don't know how many people are here, but think about that. And what we have seen across the state, it's mainly a fentanyl-related death, and that's why our death rate has increased. On February of 2015, Governor Larry Hogan and Lieutenant Governor Boyd Rutherford established the Heroin and Opioid Emergency Task Force. And they were doing that to address the issues that were occurring with overdoses and overdose deaths throughout the state of Maryland. So these were some of the recommendations that were made, and we have a panelist, an individual that sat on the panel in our audience, Dr. Michael Finnegan. So they wanted us to have access to treatment and recovery services. Believe me, we look every day for ways to increase treatment services. Improve and standardize quality of care. Improve law enforcement coordination. And I can tell you from a health department standpoint, that is what is making Wicomico a success, is the law enforcement coordination. Improve coordination and sharing of public health information. We're working on that. There's this thing called HIPAA that can interfere with that. We're also working with parents and educators to prevent youth use. We have been involved in curriculum development with the Board of Education and as part of the new law that went into effect, the Start Talking Act. So we have been working with the Board of Ed officials to begin looking at the curriculum around heroin and opiate use. Looking at alternatives to incarceration, and I know that Ella will be speaking to that, and increase public awareness. That is one of the things that we can do and do fairly easily. We are going to have forums throughout the county, and this is our kickoff. And this was a suggestion that came out of our opioid intervention team that was created by County Executive Culver. So what is being done? Wicomico County Health Department is doing a lot of different things to address this. Not any one thing will resolve the issue alone. We have been working to educate doctors and prescribers and pharmacists on the prescription drug monitoring program so that all of the individuals that are prescribing are actually looking to see what medications these individuals that are coming to them are getting. We have a number of medication-assisted treatment services in the health department, from methadone, buprenorphine, and Vivitrol. We have prescription drop-off sites at all of the law enforcement agencies as well as the pharmacies, and we've collected over 1,000 pounds of unused medications. We also provide naloxone education and the naloxone kits to the community members. We have naloxone education at the library one Tuesday a month. Treatment expansion is always something that we're looking at, as well as recovery expansion. Prevention and outreach. If we can save one life, it's one life that we can save, and that's what I tell everyone. Overdose fatality review teams. Wicomico County was one of 3 pilot projects in the state of Maryland, and we started looking at every overdose death as a group of providers, departments, public education, social services, law enforcement, to see where did we miss being able to help this individual that has died. And a lot of good information has come out of that. Case management for addicted individuals. It is very difficult for even me to navigate the healthcare system. Imagine being an individual in need of treatment and not knowing where to go, because that happens very frequently. So we're working with case managers to try to help these individuals navigate that system. Of course, we have the Good Samaritan law, which I know the sheriff will probably speak to. I won't go into depth with that. I've already talked about the opioid intervention team that the county executive formed. And of course, our COAT project That is was a pilot project. It's been nationally recognized, and that program is formed of peers that have a history of addictions and substance use, but they've had at least 2 years of recovery experience, and they respond in the field with law enforcement on overdose calls, as well as to the hospital for overdose individuals. And we've seen a drastic decline and success with that program. And they have a table set up over at the other side. So the overdoses at the hospital, just wanted you to look at this. We saw a peak in March and April of 2016. That's when the then state's attorney, who is now Judge Massarella, and I were talking at 1 and 2 a.m. Because we were so concerned about the issues. So we started moving forward with our planning and saying, what in the world can we do? We need 24-hour access to treatment, but we know that the state dollars are not there to do that, so can we form a bridge to treatment? So we've seen in the first 6 months of this fiscal year a 24% decline in overdose cases arriving in the emergency department. Let me say that again, 24% decrease. That is not something that's occurring throughout the rest of the state. I can tell you that. Some of the larger jurisdictions have seen a drastic increase in their overdose cases. This slide here, I think, speaks volumes to the efforts occurring in Wicomico County with everyone's suggestions, everyone's ideas, and our collaboration among the departments in Wicomico County. If you look at this, the total alcohol and drug-related deaths in Wicomico County for the first quarter of this calendar year decreased by 53%, whereas in the state overall, it increased by 34%. We're doing something right in Wicomico County. Total fentanyl-related deaths, huge in the state, 190% increase in overdose deaths related to fentanyl. We've had a 67% decrease. Again, we're doing something right in Wicomico County. So, as I said earlier, we are making a difference, but one overdose death on my watch is one too many. And I think those of you that know me have heard me say that many times. So we were willing to do anything in our power, and I think I speak for our opioid intervention team that we will look at every strategy known to mankind to try to address this epidemic. And you have my contact information on this last slide, and that will be put on our website, the health department's website, so that if you want to go back and look at the information, it will be available to you. So that's how I wanted to frame this conversation, and I'm going to turn it back over to Jimmy Hoppe.
Mrs. Brewster, thank you. I would like to reassure you that if you're wanting to talk to somebody to get something done in this county about this problem, there is no one more passionate than the four you see sitting in front of you right now. They were throwing elbows outside to see who'll get to go first. Also want to introduce Chris and Josh. They're back in the back right now. Guys, if you'd wave for just a second. You should have received an index card when you came in. If you'd like to write a question, hold it up in the air, and one of those two will bring it up to me, and we'll be able to ask questions a little bit later on. Also, we're doing Facebook Live. We may be getting some questions from there. Just wanted to mention that to you real quick. But right now, the man who won the coin toss, Wicomico County Executive Director, Mr. Culver.
I'm not sure if that's a win or not, but I'm glad to be here. Thank you so much. When Laurie and Matt came to me last year, 2 years ago now, and we started talking about this, I'm not the expert on it. I'll be the first one to tell you, but they are, and they knew what to do. My part, as being the leader of Wicomico County, was to try to fund it for them to see what we could do. And with that, I was able to go to the council, and nothing gets done without the two parties working together, the council and the executive. And I want to thank John Cannon and Joe Holloway are back there. I'm not sure if anybody else from council's here or not, but they saw the need also, and they backed us on the financing. The first year was $110,000. Last year we put over $200,000 in our budget for that. This year we have to sit down and see where we're going to go with it. But there's a lot more to it than just the money. It's the passion, it's the love of the people. The COPE program has turned out very well. There's one person here. Tasha, would you please stand? This is the lady that puts it all together for the COPE program. She's the one that gets a call at 1 o'clock, 2 o'clock in the morning, and she goes out to the people. So what this program basically does is when we are experiencing an overdose or any near-death situation, this COPE team goes out to the area of which these unfortunate people are shooting up. And they go out at night, the deputies are with them, and they work with them. At that point in time, the weakest point in somebody's drug addiction is when they're coming down, and we can get them into to help, and we work on that very strongly. So they do own a lot of this credit for what this program is doing. As Laurie said, we are the only county in the state of Maryland with a decrease in the addiction rate, and it's the overdose rate. So we should be very proud of that, and you should be very proud of yourselves for helping the council support this organization. So with that, we have many people on our COPE team, and they've come from across the county. Just briefly, I want to tell you that we have law enforcement from the municipalities, the county, the state. We have members from the state's attorney's office that are involved in this, the health department, the hospitals and other treatment facilities, 911 services, emergency services are involved, Department of Social Services, correction and detention, education. Board of Education is a very important partner in this also. And not to forget our faith-based organizations that are very, very important to us in this. So we need follow-up after they've had some treatments, and Comcast has been doing some PSAs for us, public service announcements, that have been helpful also. So it's a community effort, and while neither one of us will take credit for it, we're not done until we hear the last part of this, when this is all behind us. So we're very proud of our success, but at the same time, we're not successful enough yet because we still have death and we still have overdoses. So please let us know what you feel and what we can do to help make it better. Thank you.
Mr. Culver, thank you very much. Someone who has to deal with this a lot is our acting state's attorney for Wicomico County, Ms. Aladisharu.
Good evening. Thank you all for coming tonight. Our office is the only office in the state of Maryland that has a heroin coordinator prosecutor that is specifically designated to do all things heroin with respect to our office. He compiles the statistics, he works with all the agencies, he sits on the fatality review boards, he goes to other board meetings, he prosecutes almost exclusively gun and drug crimes, and most of those having to deal with heroin. And it makes a huge difference within the office because he compiles all of this information. He coordinates with Lori on probably a daily basis to see what our office can do to help with the problem. The other thing that our office does in coordination with the courts is we have a drug treatment court program, which is with the Wicomico County Circuit Court. It's a very, very intensive program where what we try to do is we look at crimes that are committed solely or primarily because of addictions issues. And most of those crimes are theft, burglary, rogue and vagabond, prostitution. They're not typically your violent crimes, but sometimes, as we've seen recently, people have robbed banks or robbed convenience stores solely to get money to go buy drugs. We try to look at these cases and determine if the underlying factor is an addictions issue, and if it is, we try to get them into the drug treatment court as opposed to putting them in jail, because although there are services offered in the Division of Corrections, they're not the services that these people need to overcome their addiction problems. And to just house them and then release them back into the community is not helpful because the addictions issue is still there and they're just out there committing crimes again. The drug treatment court is run primarily by Judge Kathleen Beckstead, and it's a phenomenal program. They're not taught only addictions recovery, but mental health issues. They're taught how to get their life back in order, how to balance a checkbook, how to dress properly for a job, how to go to a job interview. They have to do community service. This program is so intense that I'm telling you, if I ever got in trouble for something, I would probably rather go to jail than go to drug court. I mean, these people work really, really hard. And it's usually 24 to 36 months that they're in this program. And most of the individuals that graduate go on to lead a very successful life. The other thing that is available in the criminal justice system is what is called a health general commitment. And a lot of people just refer to it as an 8505. This program is for people who are incarcerated they're already incarcerated in the Division of Corrections for the most part, mostly for violent offenders. And if they're already in the Division of Corrections, most of the time we'll have them do some of the time, because there is value in deterrence. So there has to be some punishment to go along with the rehabilitation, the prevention. So they'll go to the Division of Corrections for a portion of their sentence. They'll file a motion for modification with the court asking for a health general commitment, and if that's granted by the court, they'll go into a treatment program, and it's a 24/7 treatment program. They're there all the time. They complete their treatment. When they successfully complete, they come back before the court, and let's say they received a sentence of 10 years. They did maybe 2 of that before they got the health general commitment. If they successfully complete the treatment, they'll come back before the court, and that remaining 8 years will likely be suspended, and they'll be put on a period of probation, and they'll continue their treatment and recovery during their probationary period. I will tell you that there have been some laws passed this last session that are greatly going to inhibit our ability to help people get treatment, because the legislature has reduced penalties for almost all of the drug crimes. And you can't, the only way an addict will get treatment is, 1, they've hit rock bottom, or 2, something's hanging over their head to make them want to get treatment. It's an alternative. And if there's nothing hanging over their head, we can't force them to get treatment. The legislature has, in essence, taken away our ability to do that, because they've decreased the penalties for all the drug crimes and taken away the mandatory minimum. So we are still trying, but the new laws that have come into effect aren't really coinciding with the opioid epidemic that this country is facing.
Mr. Heroin, thank you very much. Also, another facet of this entire crisis are the men and women who face it toe to toe in the streets. With that, I'd like to introduce to you Wicomico County Sheriff Mike Lewis.
Good evening. You know, when I see a crowd this large, and we weren't sure what to expect when we planned this meeting tonight, I talked with Lori earlier on the phone. We really weren't sure how many people were going to show up. But when I look across this crowd, and most of you I know, I see a lot of pain in your faces. I see a lot of hurt in your eyes. I want you to know that. It warms my heart to see a crowd this size, because each and every one of you have made a decision to get involved, and that's what we need. That's what we need. I can't do it alone. Madam State's Attorney can't do it alone. Your healthcare professionals can't do it alone. Your executive branch, your legislative branch, they can't do it alone. We need a community to get involved like I see here tonight. And when I see each and every one of you who have come out to get involved in this process, because it is a process. Not one of us in this room is immune from addiction. We've all been impacted. We've all been affected, including myself. I've put my niece in prison twice. She just got out for serving 4.5 years. She's back in Wicomico County for distribution of pills and heroin. Not one of us is immune. Madam State's Attorney just said something about our legislator and our lawmakers in Annapolis. Please know that I'm one of 4 sheriffs in the state now that serve on a legislative committee. And I go to Annapolis every single year for 3.5 months to fight, to strengthen existing laws, and to fight against proposed legislation. For the last 2 years, lawmakers in the Baltimore area have proposed a law that would decriminalize both heroin and cocaine in the state of Maryland. Please listen to what I just said. For the last 2 years, they have proposed laws that would decriminalize both cocaine and heroin in the state of Maryland. And when I testified in opposition to this, I was, quite honestly, I knew it was coming. And they're coming back again next year, and they have vowed to succeed next year. We can't allow that to happen. We need for all of our voices to be heard. We can't allow these laws to be passed, because if you don't get involved, they will be passed. I've been out at Rocky Gap State Park last night and today. I was asked to give a presentation to healthcare professionals and law enforcement and county commissioners out in Allegheny County last night. And as Madam State's Attorney and Lori Brewster said a while ago, we have seen a dramatic increase in overdoses throughout our state. We've seen a dramatic increase in fatal overdoses across the state. But in this county, we have seen a dramatic decrease in overdoses, a dramatic decrease in deaths. It doesn't mean we're not hurting. It doesn't mean it's over for Wicomico County. We will fight to the end. In Jimmy's introduction, he talked about the men and women in law enforcement. It's not just the Wicomico County Sheriff's Office. The Maryland State Police are heavily committed. The Salisbury Police are heavily committed. The Fruitland Police are heavily committed. The Delmar Police are heavily committed. We work in collaboration every single day. Yes, we all have our individual investigations taking place, but overall, we work and are co-located in one building to make sure everything is getting done. I'm proud of the work that's being done in this county. I'm proud of those who I am sitting next to up here, but I'm prouder because of the crowd we have in this room and your decision to get involved. We need each and every one of you to make this happen. But we, as you can see, but what was put up on that screen a while ago, we are making a tremendous difference. It's not over. It's not over. Because every single day we will continue to fight. I will go after heroin and cocaine dealers with everything I've got in my body until all of them are put away. I mean that. But I don't do it alone. I don't do it alone. We have great men and women in all of our law enforcement agencies working hard every single day. Last Tuesday night, I get most of my work done at night. I work all day, but I work in the office late at night, or I go out and meet people at night that want to talk to me. They say, Mike, I don't want to talk to anybody else but you. You're the only one I trust. And believe me, all my brethren, my brothers and sisters can be trusted, but people want to talk to me. And last Tuesday night, I met with a guy that laid it all out for me. Recovering addict. But some very terrible things he shared with me. Some things I'd heard before, others I hadn't. And I called our task force supervisor. I called him at night at home. He always answers my calls. And I ran some things by him. And these are things that we work on every single day. But Madam State's Attorney said a while ago, your lawmakers, my lawmakers, they're working every day to decrease the penalties, every single day. Every day. And she's so right. Most people will not get the help unless we get them in the system and have it hanging over the head and say, you've got to get help now or you're going away. They won't get the help they need. My niece didn't. She said, Uncle Mike, it's my life. I've got to live my life. I said, baby girl, that's your choice, but I'm coming after you. And you know, it's just the way it is. We cannot allow drug dealers to come into our city, into this county, unmolested, undetected, or unabated. I believe in our U.S. Constitution. I believe everybody has a constitutional right against unlawful searches and seizures, but no one has a constitutional right to escape detection. If they choose to go that route, we're going after them, and with your help, we're going to succeed. God bless you guys.
Sheriff, thank you. How he didn't win the tussle out in the hallway, I don't know, but... All right, just to remind you exactly how we're going to do things this evening. As much as we would love to open the floor to hear what you have to say, simply because of the number of people that we have here tonight, again, thank you. And the time constraints that we have, we are unable to do that. So what we are doing is making available to you the opportunity to write your question and hold it up in the air for either Chris or Josh to bring up here to me. And then we will, if you want to address it to any one of our panelists, that's fine, that's up to you. Otherwise, we will just place the question generically and let who wants to answer it. We're also broadcasting live on Facebook Live, so we may be getting some questions from there as well. All right, question number one. What you are doing is a great step forward. We sincerely thank you. When it comes to street drugs, what is being done to prevent and stop drugs from coming here in order to decrease drug overdose and addiction? Who would like to field that one?
I'll take it.
Sheriff?
The overwhelming majority of the heroin coming into Wicomico County is coming from Wilmington, Delaware, Seaford, Delaware, Philadelphia, New York, and Baltimore. The overwhelming majority of it. Most of the heroin coming into the eastern seaboard is coming from Colombia. The overwhelming majority of the heroin coming to the United States is coming through our southwest borders of Mexico. It's simply being driven across. The bulk of the fentanyl that was coming into the United States was being flown in from China. We started profiling the packages coming from China to better interdict these packages. They realized what we were doing. Now they're simply shipping their packages down to Mexico City, and the Mexican cartels are driving it across the border into the United States. That's precisely how it's getting here. Everybody has a constitutional right under our Fourth Amendment against unlawful searches and seizures. So when we stop an automobile, because it's coming in by car, it's coming in by truck, it's not being dropped out by parachute and simply being parachuted into Wicomico County. It's being driven into Wicomico County. But we have to have probable cause to make that stop. And when we stop those vehicles without probable cause, we can't search it unless we have a drug sniffing canine. In Wicomico County, we have now have 6 dogs that are trained to detect heroin and cocaine. When that dog scans that vehicle, if the dog alerts for the positive presence of narcotics in the vehicle, we can conduct a warrantless search of that vehicle bumper to bumper. That is how the overwhelming majority of our drugs are seized on traffic stops. And through the good investigative efforts of the men and women who work in undercover capacity here in Wicomico County. They work directly with our uniformed individuals, and we coordinate these traffic stops, or we coordinate search warrants of homes. But we cannot simply go into home because we think or believe they have drugs. We have to make an application for a search and seizure warrant. It goes for a legal sufficiency review to our state's attorney. Then it goes to the judge for his or her review. And then once that search warrant is signed, we can go into the homes. But the overwhelming majority of it is being brought in by automobile into this area every single day. The bulk of it coming from Wilmington, Seaford, Delaware, Philadelphia, or New York or Baltimore.
Sheriff, thank you. Absolutely. Is there an especially high risk for newly released inmates who have detoxed while being incarcerated and thus have no tolerance for fentanyl-laced heroin when they return to using? If so, is a Vivitrol shot available or mandatory for such vulnerable inmates?
I think I drew the short straw on that one. There are many programs available in the community to address the inmates coming out into the community. It is a very vulnerable period for these people. The first 2 weeks from incarceration when they have detoxed is the most vulnerable time for them to potentially overdose. Vivitrol is available in many providers, including the health department. Our Vivitrol expert, Dr. James Cockey, is in the audience, and it's also available among other providers as well throughout the county.
All right, I can tell you by the number of questions that we're getting now, I'm going to hurry to try to get to all of them, but I can't make any promises. Since most heroin and opiate addicts are homeless, when is the focus of getting housing and jobs for people who are addicts? Because what's the use of getting clean when you have nowhere to go or sleep? Jump ball.
We've got what we've got in Wicomico County, but there's no halfway houses that I know of here that we could send someone to, that, you know, that many of them. I think we do need more residential treatment programs and housing for that. So that's something that the council and I will have to look at and see if we can afford, you know, especially if we get a motel that decides to sell or get vacated in Wicomico County. That may become the perfect location for it. I don't know. So, I mean, to say that we've got enough places, no, we don't. But are we aware of the problem? Yes, we are. But correcting that problem is going to be tough.
In addition, our COAT team members will help the individuals with all of the social supports that they need to remain clean and sober in the community. So if housing is an issue, they will work their best to find appropriate, adequate, safe housing for them. Does it happen all the time? No, but they will work with the other agencies such as the Department of Human Services. The City of Salisbury has a housing program, so they have the resources available to them, and they will do the best that they can to try to help them.
I think it's incumbent that we do get a residential treatment program or a transitional housing here in Wicomico County. It's incumbent. The time has come. We don't think, well, we got to do it. We've got to do it now. Now is the time. I firmly believe it, and if my speaking out helps that happen quicker, then I'm all for that. But it's something that has to be funded by the county and or the state with a grant, but it's something that has to happen because I see so many people that want to do well. They're ready to be productive members of society, but they feel that they don't have the worth to go out here and get a job, that people won't allow them to get a job. They run their records. They realize they've been convicted or they're addicts. And it's time that we all step up to the plate and make sure that we get some type of transitional housing for that.
Doctors are still prescribing and treating individuals with narcotics without asking about a history of addiction. What changes are in place to control this? When will hospitals and doctors use non-addictive pain management opiates? Many addictions begin this way.
We are working feverishly on that. We have been ever since the opiate epidemic started, and in our area, we really believe it started in 2012. Dr. Cocky has worked very feverishly with the pain management specialist in our community, as well as the hospital, and the hospital has a representative here, Dr. Sylvia. The Center for Disease Control has also stipulated guidelines on adequate opioid prescribing. Is it enough? Probably not. But the other thing that will be taking place is the prescription drug monitoring program, where physicians will be required to look to see what individuals are being prescribed, so that they can really find out if they are doctor shopping, because we know that they have a tendency to do that, but it will not indicate what illegal substances they may be using.
I think they've also implemented a system where even pharmacies can now look into a system to see what other prescriptions that these individuals have picked up at different pharmacies. The only problem with that is it's only in Maryland, so the fact that we live so close to the state of Delaware, they could go to Del Mar and fill a prescription at Walgreens, and the pharmacists in Maryland wouldn't necessarily see that they just filled a prescription there. I also think that the medical profession is doing a lot more with respect to prescribing less. So before, you might go to the doctor and you would get a prescription for 30 days of oxycodone. Most people don't take it for that long, so they'd put it in their medicine cabinet and children would get hold of it. And I don't mean young children, I mean our teenagers, and then they become addicted to it. I think they are much more frequently now prescribing like a week's worth. And then if you need more, you go back, you have to be seen again. I think they are very conscious now of how much they are prescribing and to whom they are prescribing it. I'm not going to tell you because I know for a fact that we do have some out-of-town doctors who will come and set up in, say, a hotel room and prescribe medications. And there is nothing illegal about that because they are licensed. So they can set up in a double room. One room's the waiting room, the other room is the examination room, and they abuse it. That gets reported, that's been investigated by our undercover narcotics task force. It's been reported to the medical review board, but there is nothing illegal about what they're doing, so there's nothing that me, myself, or Mike, or Bob could do about it because they're not committing a crime. But I think that the good doctors in our town, in our community, are very conscientious about what and to whom they are prescribing and are trying to make an impact in decreasing the opioids in our community. I will ask you to please guard your medications. You might not realize the signs of heroin addiction are not completely obvious. You may not know that your child is starting to sample with opioids. Guard your medication, because that's how it starts. You know, somebody came up to me one time and said, I don't understand why somebody would take a needle and just stick it in their arm and shoot that stuff into their blood when they know it could kill them. But that's not how it starts. It starts by pain management. It starts by just this pill that the doctor prescribed that must be safe because it came from a doctor. I've had it a couple times at a party, and before they know it, they're addicted to it. Guard your medication because that's where it starts.
What are the stats as it relates to the drug court repeat offenders? Do we see that this drug court program is helping with repeat offenders?
The drug court is absolutely helping with offenders. Now, I'm not going to, most people who are in drug court are already repeat offenders. Most people who come to court the first time for some type of crime, especially if it's simple possession of cocaine or simple possession of heroin, they don't go into drug court because in their mind, one, they're not facing enough time. Because I will tell you that going into drug court is often an excuse to get out of jail. And that's okay. Because when they get into drug court and they start getting the treatment, it turns into something so much more for them. And they start realizing that a clean and sober life is so much better than the life of addiction that they've been living. But your first-time offenders typically don't go into drug court because at that point in time, in their minds, they don't need it. They're not addicted. They were just sampling with something, and drug court's not the thing for them. It's usually your repeat offender that ends up in drug court because at this point in time, they are facing a boatload of time, and they are looking for any way to get out of going to the Division of Corrections. So we look at their record, and you can usually tell by somebody's record whether they have a substance abuse issue because you'll see CDS possession, CDS possession. Sometimes they'll distribute for profit, but they're not your regular drug deal. You'll see theft, because they're stealing to support their habit. So we can usually tell by looking at a criminal history who the addict is, and if they decide they want to go into drug court, it's an extremely strenuous program, and I can tell you if they graduate from that program, they usually stay on track.
I'm a recovering heroin addict with 14 months clean. She says she is currently attending Warwick's CDC program. My heart is with the COAT program and I want to help. Why do I have to be 2 years clean to offer my help?
That's a state requirement. And you have to understand, and this was something that was a little difficult. Imagine you are a law enforcement officer, and I come to you and say, I'm going to have a recovering addict ride along with you. That took a little convincing, did it not? So the ideal is the 2 years in recovery, and what our requirements are through the state, and because it is a state position, but we also want to get those individuals certified as a recovery specialist, and the state requires a minimum of 2 years in recovery. Whoever you are, congratulations. I am so grateful that you spoke up. Keep us in sight. We'll be looking to expand our program. As the county executive said, we will be looking at funding, and he knows I'm not shy of asking for dollars. So keep us on your radar, and we will keep you on our radar as well. So when you hit that 2 years, we'd be glad to talk to you.
Only 10 more months. You can do it. Hear me out on this one. First of all, I'd like to be armed. Just kidding. I see drug dealers and guys on bikes all day long selling to the residents. What can I do while still staying safe?
First of all, I think everyone knows that my email address is on our website. I get emails all the time from my community. And I guarantee everyone complete anonymity. When you send me a drug tip or any information on a drug dealer or any crime that has occurred in our community, before I forward that to my investigators, my detectives, normally I will preface my forwarding that email with a phone call to them, and I will cut and paste the information. Therefore, they have no clue who it came from. I don't want them to know who it came from because it doesn't matter. The important thing is we need to get that information. You can pick the phone up and call me. You can send me an email, but please see that we get that information. And while I would love to be the person who gets it, we have many law enforcement officers in this community. You know, everybody knows a police officer. Please don't hesitate to share that information as quickly as possible, because we want the drug dealers as well.
As a follow-up to that, if doctors are giving out prescriptions daily and the patients know who they are, can't we turn them into the police?
Well, let me say this. I got a call from a lady in a doctor's office today here in Salisbury, and she gave me information on an individual that she thought might be involved in criminal activity. I was on my way back from Rocky. In fact, I was coming through Hancock, Maryland, which is between Rocky Gap and Hagerstown. But she gave me the information. I called my office, gave it to my guys immediately. Our deputy set up on the individual. When he left the doctor's office, they did a traffic stop on him, and he was arrested. He had 2 separate warrants from a couple different locations, and he was also up to no good at the doctor's office. He was shopping for pain management. We knew that's likely what he was doing. She suspected that's what he was doing. And these things happen with regularity. We will get calls from a doctor's office here in Wicomico County. And I welcome those calls. I welcome those calls.
Do you think maybe the numbers, and they are referring to the statistics that you gave us early on, Lori, are down because of Narcan, and it's not reported?
It's very possible. As I had alluded to earlier, this is a multi-pronged approach to address this issue, so it's not one individual strategy that's targeting this reduction. It's all of the strategies. The laundry list that I gave you earlier, which included coat, but it also included the naloxone.
Thank you for your very hard work with the addicted adult population. There has been a 4-fold increase in drug-addicted babies since 2008. The length of stay for a withdrawing baby is anywhere from 2 weeks to 3 months in the hospital. What is being done to protect these babies at time of discharge, and what is available for the mothers, both during pregnancy and after birth?
I will say I wasn't supposed to be a panelist.
Oops.
I'm pleased to tell you that through an agreement with the Department of Human Services, and the director, Paula Erdy, is in the audience. Please wave, Paula. We have a signed agreement that our COAT team members will respond to the child advocacy center where those babies and the mothers will be reported for follow-up. We will try to help them access treatment, whether it's substance use treatment, mental health, or whatever they may need, so that they can keep their child at home with them and the child can live a successful life. The goal of the Department of Human Services is to keep families together, but the only way they're going to be able to do that is to get adequate treatment for the parents and make sure that the children are okay.
What can you do for possession charges? Instead of incarcerating people, treatment programs should be more available. Why does the 8505 take so long?
First, I want to tell you that there's a thing that's called the Justice Reinvestment Act that passed last year, and it went into effect October 1st, 2017. It decreased the penalty for possession of a narcotic from 4 years to 1 year. So I'm going to be totally honest with you. Through the criminal justice system, there's not a lot we can do for a charge of simple possession of a narcotic, because Maryland does not have truth in sentencing, which means that if it's a non-crime of violence, which is what any drug offense has been deemed by the legislature, whether it's drug dealing or drug possession, it is not a crime of violence. You are only required to serve 25% of your sentence before you are eligible for parole. So if you go to court and you have been charged with simple possession of heroin or cocaine, and you get the maximum penalty, which is 1 year in jail, you are probably going to be out of jail in 3 months. So there's not a lot we can enforce in 3 months, because you are not going to overcome a heroin addiction in 3 months. And they're not going to put them on a period of probation for a year hanging over their head. So for simple possession, we wouldn't even recommend them into drug court, because drug court is so strenuous that there has to be an incentive to complete the program. And if you know that you could go to jail and spend 3 months in jail versus doing 24 to 36 months of people being all over you, and you even waive constitutional rights when you go into drug court, they can come in and search your house at any time because you've told them they can. And if you're looking at max 3 months in jail, why would you do that? So for simple possession, there's not a lot we can do now. The penalty was 4 years, which gave us more leeway, because what we would do is we'd have them plead guilty to simple possession of the narcotic. They might do a limited period of incarceration, maybe 6 months to a year, but they would have that 3 years hanging over their head, and that was incentive for them to get into treatment, to get into either drug court, even through parole and probation. Whenever there's a crime, even if it's a violent crime, that we believe had some underlying addiction issue, we always recommend, and the court almost always imposes the condition of probation, that the person enroll in and successfully complete any mental health counseling or addictions counseling as their probation agent deems appropriate. But there's no point in putting somebody on probation if there's nothing hanging over their head. It has no teeth. So because of the decrease in the law, someone that's charged with simple possession of a narcotic is probably just going to do their time and be released.
An 8505 is a court-ordered evaluation to determine whether or not inpatient treatment or other treatment mechanisms would be in place. Yes, there is a backlog. The state, as part of the Justice Reinvestment Act, has they've told the Behavioral Health Administration that they need to open up beds, and they have. The backlog has dropped from over 100 down to about 30. They are being measured on the length of time it takes to access a treatment bed. So the Justice Reinvestment Act has made some difference in the 8505, 8507 world.
If you suspect that a house in your neighborhood is suspect of illicit drug activity, who should you report it to?
Should definitely be reported to law enforcement, but once again, I will gladly take all calls and emails. Mike Lewis at wicomicocounty.org. Mike Lewis at wicomicocounty.org.
Mike, do you think it's the local police that should get the first call?
If the house or the location is in the city, I will forward immediately Chief Barbara Duncan and her assistant chief. If it's in Sussex County, Delaware, I will forward it to Delaware State Police. I don't care where it is. I have contacts in those areas. I will forward it to them immediately.
So if there's any question about who to call,
Send it to me.
call Mike.
Absolutely.
All right. Thank you.
Thank you, Jimmy.
All right. Let me share this with you very quickly. I am a grateful recovering addict. I'm a graduate from Baltimore City Drug Court, 5 years clean next month. It burns me up when we promote medication-assisted treatments like methadone and Suboxone. Why don't we open some all-holistic rehabs for complete abstinence with all-natural treatments? I am a certified yoga recovery teacher, have a passion for recovery, would love to help in any way possible. But why do we promote or offer more drugs for the solutions when that's the problem?
Medication-assisted treatment is just one option for an individual. We offer at the health department many different options. We do not offer some of the holistic treatments such as yoga because it is not a service that we can actually get paid for. And I know that sounds bad, but if you're running a business, you have to get paid to operate the business. If whoever you are, if you would like to talk to me about coming and helping, I'd be glad to talk to you.
I am finding questions just as quickly as I can and trying to keep you out of it. I see and hear the multiple programs and resources available for adults. My question is, what preventative programs are available for our youth and adolescents? What programs are implemented in the school systems?
We are working with the local Board of Education to revise their health curriculum and a focus on heroin and opioids starting at grade 1. Of course, the curriculum will be different for a first grader than it is for a 12th grader. But we are working very, very hard with them. And one of the things that I think is really key is getting to the children at any age so that we can help with the prevention later in life. The Board of Education was required as part of the Start Talking Act to work on this curriculum. But we in Wicomico County have been working on this curriculum for the past year. So it's not that we waited until there was a legal requirement to do such.
We want the 14-month person in recovery for Hope Corps. If you're a community member interested in being involved with heroin and opioid prevention education, we're actively recruiting and placing members who receive an educational award to help with the tuition costs or outstanding loans, as well as training. I will let you guys handle that between you. The question is, what is being done to decrease the stigma?
Wicomico County Health Department is having a anti-stigma workshop. The date is the 14th. Stigma is a huge issue, and we realize that. And we want to do anything in our power to address the stigma associated with substance use and accessing treatment. Because without accessing treatment, they're not going to be in recovery. So anything that you think of that we could do, we're doing media campaigns surrounding the stigma issue. We would be more than happy to entertain a discussion.
I'm not going to get this completely right because the Justice Reinvestment Act is like 204 pages of really, really tiny print. But one of the positive things they did is that now when somebody successfully completes probation, they get a certificate. And the Justice Reinvestment Act counsels employers, I'm not going to say prohibits them, but it's somewhat of a state push that they cannot deny somebody employment solely because they have a prior conviction for some type of minor nonviolent crime. So if they submit the certificate to their employer, they're not supposed to deny them employment solely because they have a criminal history if it's for a misdemeanor.
It certainly clearly is being destigmatized, because I've got drug addicts and recovering drug addicts calling me. They never called me before. They ran the opposite direction. And they call me now wanting to meet with me, and there are times I meet them in a very public place, but there are times I meet them in a secluded location, or they simply come to my office like the gentleman did last Tuesday night. And that would have never happened a year ago, let alone 5 years ago. Wouldn't happen a year ago. So it is being destigmatized, and it's something we need, because that's the only way we're going to move forward and make any progress.
What are the chances of getting a sign stating Narcan trained for people that are trained, so that if a neighbor's overdosing, someone in their home would know who to reach out to for help until emergency personnel can arrive?
We give out certificates of completion if they attend our naloxone training. We can look at making up little cards, wallet cards, in the future. If you think that that would be beneficial, we will certainly do that.
Once arresting a person for doctor shopping, what services do they receive, or are they referred to treatment? Are there better ways to help those people? Have you ever considered the method used in Massachusetts, where the police department has taken the treatment approach, referring the person to treatment instead of jail?
We have a lot of individuals who, as I said, it's most of the time they have to have something hanging over their head to enforce the treatment part of it, because it's hard. I mean, I'm sure a lot of you know it's just hard, and it's easy to quit. But if you have that time period hanging over your head where I might go to jail if I don't go to treatment, they go enough, and eventually it becomes a lifestyle for them. And we refer a lot of people into treatment right away. You can actually get a 8505 commitment prior to resolution of your case. So there are ways in which we see an individual who needs treatment more than incarceration, and they actually get that first.
What services does the county want to expand in order to fight the issue?
Well, as I said, I believe in residential treatment programs, and I think that that's going to be a way to continue on with the treatments. We've talked to some people. There's a program down in North Carolina called TRESA, and we have some people local that want to start that program here in Wicomico County. So we, as a county, have been looking to try to secure a place for that, to help them out and get that started. So we're working with that. You know, it all goes back to money. You know, it's just a matter of how much can we spend, how much can we do. We want to make sure that our dollar is spent the best possible way that it can be. There's not a shortage, but it's got to be well used, well maintained, and well thought out before we just throw money at a problem that we don't know how to cure. So I look to the experts to do that, and then the council and I will sit down and say, you know, this is where we need to go.
What will it take to get a detox unit at PRMC?
I'm not sure at this point, but I will say that PRMC is very active on our opioid intervention team, and there is representation here tonight, so I'm sure that they've heard your plea. And it's not something that we have not talked about before. So we will keep that in mind, and that will be one of the topics of our discussion in our opioid intervention team.
My cousin has been on heroin since her son's first birthday. He is now 3, and mom now takes care of him full-time, with the mom being MIA. She has tried for custody. The law still will not grant her custody. Why would you want a child in that kind of care when they have a reliable, drug-free home option. So I guess the question of this is there anything we can do to make custody by someone else for a child a little simpler, a little easier?
I'm not going to try to answer that because I do criminal law and that is civil law. But I will tell you that the Department of Social Services' purpose is to try to keep families together. It is extremely difficult to take a child away from their biological parents. And I don't know what more I can tell you. I mean, it is extremely difficult to take a child away from their biological parents.
But I'll bet you can probably find a legislator close to you that you can open your heart to and get them to understand exactly what your feelings are regarding this crisis as you're sharing with these panelists here tonight. What does the picture of opioid use look like within the geriatric population in Wicomico County regarding pain management issues, misuse of meds, overdose numbers in this population, isolation, and related issues?
The geriatric population is not immune to the epidemic. Sometimes they end up abusing their medications because it's not clear as to how they are supposed to take their medications. I personally have been into an individual's home who had medication bottles from 10 years ago that they were taking, and it's very disheartening because these individuals don't have anyone helping them manage their medications. As far as overdose deaths, we have seen some in the geriatric population, and I'm classifying that as 65 and older. And part and parcel, they have been heroin overdoses, not prescription overdoses. So I think that we need to keep that in mind as well, that they are not immune to using heroin as a method of controlling their pain. And it's difficult to get a pain management physician these days, one that will actually assist individuals because of previous physicians and their outcomes related to overprescribing. So a lot of the physicians are very cautious in treating pain. I don't know if that truly answers the question, but it is a concern.
And I can say that there have been many times I've gotten phone calls from individuals who have lost a loved one, an elderly loved one of their family, and they'll call me up and say, Mike, I have discovered a boatload of medication. I had no idea she had this in the house, or I had no idea he had this in the house. What do I do? And I'll tell them to put everything in a plastic bag for me, and I'll go by their house and actually pick it up for them and take care of everything. They don't have to sign anything. They don't have to do anything. And I will take that medication back to my office for disposal. And I do mean trash bags, pounds and pounds of medication that I've picked up over the last several years from homes of individuals who have lost a loved one. So if you get in a situation like that, please know that we will come and collect it for you, or you can bring it by any state police installation, any sheriff's office, the Salisbury Police Department. We have disposal receptacles at each one of our installations to take care of any and all unwanted medications from your home.
Lori, I just want to tell you thank you again for making this possible, the opportunity for everybody to talk to these passionate panelists about what can be done, where to go, things to do, but also possibly an unexpected side effect of what you have done here tonight is you've brought together not only people that are seeking help, but people who are seeking to help. So I would like to, while of course we do have a duplication of some questions, I would like to share with you a few of the things that have been passed to me this evening, just to let you know who is sitting next to you. What are the options for a heroin addict who wants to quit but is unable to do it themselves? Long-term help is hard to find. What can I do as an individual to help? I'm getting the education at Warwick, and outside of that at a mental health and addictions service. What else can I do? I'm passionate. Please let it be known there's another program to go to, Celebrate Recovery, a 12-step faith-based program for anyone and everyone with a hurt habit or hang-up. This is a judgment-free place. If anyone would like more information, we are wearing CR shirts and we'll be here after the meeting is over. Some information that has been passed to me. Please understand, this is information that has been passed to me. I have not had the opportunity, neither has anyone here at the panel had the opportunity to verify these facts as facts. So I just want to share with you what this one says. Vivitrol available at CDC has been on for about a year. There are 9 halfway transitional houses in Wicomico County. Hudson Health has 3, soon 4. Douglas Hamilton House, Bayside House, 3 Oxford houses. We have residential treatment in Wicomico County, Hudson Center since 1980. So in case you want to check that out. I have a youth group that ranges from 5 to 18. At what age can I address this issue? And while faced with a child that is addicted, most of us are unaware of the signs of addiction. Will there be education for parents along with the education being introduced into the school system?
The office actually put together and I'm sure that Lori probably helped, but put together opioid abuse and signs and signals. So just for your knowledge, unusual excuses for behaviors, appearing ill in the morning followed by a quick recovery, moments of nausea or vomiting, losing interest in hobbies and sports, becoming disassociated with family functions, seeming confused, constricted pupils, loss of consciousness and intermittent nodding off, excessive talking quickly followed by drowsiness, becomes exhausted easily, often feeling agitated or restless, scratching of the skin, excessive sleeping, being a recluse at home, darkness under the eyelids, withdrawing from social activities, decrease in appetite, short and frequent trips out of the house, and constantly asking for money. Those are just some of the signs that would be exhibited by somebody who has started using or become addicted to opioids. Did you want to pipe in on that?
Sure. I think part of the question was, at what age do you start talking? Any age. It's just how the message is delivered, and we would be, at the health department, willing to assist you in developing that message, because as I said earlier, the message for a 5-year-old is going to be very different than a message for a 12-year-old. So we're willing to help with that through our prevention office, and our prevention director is sitting in the front taking notes.
And just as a reminder, if you've thought of a question that you would like to ask but you don't have a note card on you, just hold your hand up. Either Chris or Josh will be sure to come find you and then bring your card up here so that we can ask the question. As elected officials, what are you doing to assist us in Annapolis to address the needs of Wicomico County?
I think both Mike and I spend about 3 months a year in Annapolis testifying. I know several nights we were there until midnight, 1 o'clock in the morning. Marijuana legalization, we testified against. Justice Reinvestment Act, we testified against. Removing the aspect of resistance from rape. We don't have to prove resistance anymore when it comes to rape. What are some of the things you've testified to?
We also testified in opposition of the decriminalization of heroin and cocaine. As Ellis said a while ago, we're in Annapolis some nights until 12:30, 1 o'clock in the morning, and absolutely exhausted. And I've spent many nights in Annapolis at the Lowe's Hotel without a change of clothes because I had to be back the following morning to testify. But we do what we have to do because there are few people across the state who truly care enough to go to Annapolis, take time out of their busy schedules to testify in opposition of some of these laws. If we didn't testify in opposition to some of these laws, and there wasn't a different side or a different part of testimony being offered, and they only heard the advocates for this legislation would pass. It would absolutely pass. I was dead set against the decriminalization of marijuana. That's not what we're here to talk about tonight, but I think any drug is a bad drug. It's just bad. And I know, we know how bad heroin is, we know how bad cocaine is, and there was a question asked earlier about the stigma of heroin and being an addict. And again, I have made my mind, if we learned a long time ago, there's no way we'll ever arrest ourselves out of this problem. That's not our goal. But we have learned there are so many people who will not get help unless we arrest them and get them into the system and hold it over their head, like Madam State's Attorney said earlier. I know that. I've had so many beautiful family members, many I recognize here tonight, have called me up. I'll go to their house, sit with them at their dining room table. What can I do to get my granddaughter, my grandson, or my brother or my sister off of this stuff? And sometimes it's coordinating with law enforcement to conduct a traffic stop. When they know they've got it in the car, we arrest them, we bring them in, and we hold it. You've got to get help now. And we get them, and we get them on the fast track to recovery. And a question came up earlier about why do you need 2 years? Well, first of all, if you've got 2 years in recovery, it now appears to everyone that you are on a sustained path of recovery. And that's what we want to see. That's our goal. We have often, our undercover officers in this county, we have had addicts in the car leading us to a drug house when they've overdosed in the police car with the undercover. And when we've tried to bring them out of that overdose with Narcan or naloxone, they beg us not to do that because they want to experience that high. But those are the things that, we've got to get them on the fast track to recovery, and a minimum of 2 years, I think, is right on track. That's what we need to have. And I fully understand that because it's clear to us then that they're on a sustained path to recovery, and we've got to have that. And the only way we're going to do it is working together.
My part's a little bit different than Mike and Ellis. I work more with Clay Stamp as the director for Governor Hogan as far as the opioid coordinator, and I work closely with Governor Hogan and Clay Stamp to try to bring the different programs down. What I've learned basically is I am the state representative from the Maryland Association of Counties for this Justice Reinvestment Act. Again, as I said before, it all goes down to money. A lot of these larger counties are the ones that have started this Justice Reinvestment Act. They want to get rid of the bail bondsmen and allow these people to go back out on the street. In meeting with all the judges in the state of Maryland, I just said that's not going to play well down here in Wicomico County. We don't feel the same way as they do. But it's because the jails in Montgomery County and in Arundel County, they've got such a much larger population, it costs so much to incarcerate someone nowadays. Even our small jail in Wicomico County, my budget's over $8 million a year to keep that facility open. And that's not cheap, so for a small county with 100,000 people. So you can imagine what Anne Arundel County costs them. So that's how a lot of this Justice Reinvestment Act got started, was to try to reduce and get some of these people back out on the street for minor crimes. But they will not hold somebody unless it's a major crime or a major, I guess you would say, a pusher in that sense, or a supplier. And for anybody using, then we have the problem here also is the fact that if that person's out and we find them using again, the state of Maryland has one, I guess, representative as far as doing the urine test, and that's out in California. Well, they're not going to come all the way to Maryland to testify in court that that person was dirty. So we can't relock them up or anything like that. So that way they just stay out. And that's the fallacy in the program. I will tell you now that I'm working very closely with Governor Hogan in trying to get a criminal lab in Wicomico County for the entire eastern shore of Wicomico County. So I think that will expedite things from Mike's department, every law enforcement department in the county. But it's a lot more than just, you hear about it. We need participation. We need participation on a state level by you all. And maybe we need to get it out. We hear these bills, we go up and we testify against them, but we need to let you all call all the people, all the delegates we have. We have very few delegates. Anne Arundel County has 47 delegates to the state legislature. We have 7. So we don't have a snowball chance sometimes of making it work. So we need your help too.
Mr. Culver, thank you for bringing the justice reinvestment back into mention here. With the new laws related to justice reinvestment, what changes will likely occur related to treatment versus incarceration?
Well, I think we already talked about that a little bit. With the decrease in penalties, it's going to decrease the resources available to us to implement treatment, the Justice Reinvestment Act also changed many things about parole and probation. They took away a lot of the court's discretion. So somebody goes to court, they get 10 years, suspend all but 8. That means they do 2 years, well, let's say it's a crime of violence. They do 50% of that 2 years, so they do 1 year. They're released back into the public and they're put on probation for maybe 36 months. And if they violate a condition of probation, they go back before the court, and the court can reimpose that 8 years that he previously suspended. But the Justice Reinvestment Act changed that. So if it's what they have deemed a technical violation, and they're all defined in the act, but technical would be like testing positive for CDS, failing to report to your probation agent like one or two times, not going to treatment. Those would be technical violations. They don't even have to be reported to the court now. They're handled by parole and probation. So if you get to the point of a technical violation where it does have to be reported to the court, then unless it involves committing a new crime, absconding from probation, violating a no contact or stay away order of a victim, or some other aspect that's deemed a public safety issue, the court is told that for a first offense, first violation, they can impose 15 days. For a second violation, they can impose 30 days. And for a third violation, they can impose 45 days. So this person has this 8.5 years hanging over their head, and what's available to the judge absent new criminal offense, absconding from probation, violating a no contact order, and there's a couple more, he's got 45 days at his disposal. So I can tell you what's going to happen. They're going to stop putting people on probation. What they're going to do is they're going to give straight sentences. So they're going to go to jail, they're going to get whatever treatment they can get in jail, then they're going to get out. And there's not going to be anything hanging over their head to enforce any type of treatment. The other thing they did was they eliminated mandatory minimum sentences for drug dealers. So prior to October 1st of this year, if somebody was convicted of a second offense for distribution of a narcotic, they could get 10 years without parole. So I told you Maryland doesn't have truth in sentencing. So if they get 10 years and they're not a subsequent offender, they might do 3. That's how it is now, because there's no subsequent offender. With subsequent offender penalties for a first offense, they could get 10 years mandatory minimum with limited possibilities of parole. For a third offense, they could get 25 years in prison with limited possibilities of parole. For a fourth offense, they could get 40 years in prison. So getting rid of mandatory minimums doesn't really mesh with the crisis that we're currently involved in, because it's putting drug dealers back out on the streets. And Bob Culver said that one of the purposes of the Justice Reinvestment Act is to decrease the population of Maryland prisons for the purpose of taking the money that they're going to save by not incarcerating people and putting it into treatment and recovery. And if that money actually goes into treatment and recovery, it might work. And it's a noble purpose. But I just fear that it's going to have unintended consequences, and drug dealers are going to be back out on the street much, much quicker than they otherwise have been. And the people who were sentenced prior to October 1st of this year, who received mandatory minimum sentences, can now file a modification with the court to have that sentence reduced. So on the one hand, we're trying to fight opioid epidemics, and on the other hand, we're decreasing penalties for drugs and letting drug dealers back on the street. We've testified against it. Mike and I have both been there on numerous occasions. Maybe if everybody starts writing and expressing their dissatisfaction, maybe something will change, because I think that it's going to get worse, not better, with the new laws.
You know, what's really, really frustrating to me, what Ella just spoke about, is the hard-working men and women that you all have in law enforcement in this county. Hard-working men and women are in the trenches every single day fighting and going after these drug traffickers. And when we finally get them, and we convict them, we know it's just a matter of time before they're back out on the street. We know that. It's a matter of time before they're back out on the street. And oftentimes our police officers, while going after them and fighting them, are oftentimes injured. They suffer debilitating injuries, and they are medically retired. Meanwhile, this drug dealer is right back out on the street. And it's extremely disheartening and frustrating to me and other law enforcement executives. We know the work that our men and women are doing. We know how many hours they spend working undercover in many cases to identify these individuals, to surveil these individuals, and ultimately collaborate with us to bring them in, only to be convicted and be back out on the street within a year or two. It just doesn't make sense. Why? Because they're non-violent offenders? Are you kidding me? How much violence is associated with drug trafficking? 87% of all crime that we investigate today in law enforcement, 87% is directly linked to drug addiction. 87%.
I've prosecuted about 28 murders, and I will tell you that about 2 of them did not have an underlying drug aspect to it.
That alone should tell everybody something. 26 out of her 28 prosecutions for murder were drug-related. We all know that. Another thing that we need to understand, and it's difficult for me to say what I'm about to say, we Americans only make up 7% of the world's total population, but yet 68% of the world's total drugs are consumed here in the United States every year. Why? Because we are the wealthiest nation in the world. And where there's a demand, and think about what I'm about to say, and dispensable income, people are going to spend it on entertainment and what they want to spend it on. And they dare you to tell them what they're going to spend it on. And drug traffickers, the Mexican cartels, are fighting over control of the industry here in the United States because they know we are the largest consumers in the world of illegal narcotics right here in the United States of America. And I got news for you folks. Until we have border security, we'll never have homeland security.
Do we have a cost comparison of incarceration versus treatment?
I do. It's back at the office. We will put that information up on the website in answer to that question.
But I can say that we just recently had the COAT program analyzed by Beacon, and for every dollar we invest in it, we're getting a return of $7. So that's something to be very proud of in the COAT program. But we're getting, again, that's $1 we spend, we get $7 back in benefits from.
And that report is on our website, wicomicohealth.org.
I find it interesting that there is no other ethnic group, excuse me, other than Caucasian. Where is the diversity in our leadership? That may rest with you.
You are the voters. We're more than happy. I mean, Wicomico County is open to anybody. We welcome the diversity. I feel very strong with the diversity within our departments. So we have black, white, we have everybody that we can possibly get in there. As long as they're qualified, we're more than happy to have them. I encourage the fact that if they want to come to work with Wicomico County, we are open. We've got plenty of jobs on the job site, so come see us.
Do you think that drug dealers should be charged with murder for selling heroin and the person overdoses?
Do I think he should? Yes. Can I prove it? Probably no. And I'll tell you why. Is that you have to prove the intent to kill. So take fentanyl. If it's in, fentanyl is extremely deadly. I mean, we K-pack it. We put it in plastic bag, thick, it's marked. We don't even want police officers touching it. In fact, in the past year, they used to do what they called NIC kit testing. So they would do a traffic stop, they would seize the substance, and they would take a little bit of it and test it. It's too dangerous now. We don't even want them doing that. They can say, based on my training, knowledge, and experience, I believe the substance to be cocaine, heroin. It's just too deadly. So in the case of heroin laced with fentanyl, we still have to prove that the drug dealer knew that the heroin was laced with fentanyl. Unless he admits it, that would be incredibly difficult to do. Now, I will tell you that Governor Hogan passed a law this year that makes it a felony to distribute heroin with fentanyl or any analog of fentanyl, which carries 10 years in prison, which is in addition to any other crime that they're on trial for. I know that Worcester County prosecuted a case where an individual overdosed as a result of use of heroin, and it's always a fact-specific. Everything we do is factually specific based. Some facts with the same circumstance could be chargeable, and some facts in another circumstance may not be chargeable. But the case in Worcester County, they respond, the individual is deceased. There's another individual there with him who had called 911, and he said, the guy asked me to go get him some heroin, and I told him I could get it from such and such. So I drove him to this house. We came back. I had like 5 bags. He wanted to do 4. I told him that was way too much. He started overdosing. So I called the ambulance. Kind of in a story, and if that had been all we had, they probably wouldn't have been able to do much with that. But they were able to seize his phone, and he's Googling how to stop a heroin overdose, how to fentanyl. I mean, there was enough information in the facts of the case where they were able to show that this individual was in fact the person who distributed, because typically when a person overdoses and police respond, their drug dealer's not standing next to them. So the first thing you have to do is figure out who sold it to them, and that in and of itself is a task. From there, you have to try to figure out, did the person that sell it to them know that it was laced with fentanyl? Most likely they did not, because it's a chain. And you know, Mike's talked about the drug task force, and they are always trying. Their primary goal is not to get the street level distributor. Their primary goal is to go up the chain and get the big guy that's just bringing the drugs into Wicomico County. It'd be very difficult to prove that a specific person sold somebody heroin with the intent to kill them, because the first thing that the defense attorney is going to say is, why would they want to kill off their clientele? That would make no sense at all. And we are very logical sitting here tonight. But I will tell you, when you get in a courtroom and you're in that jury box and you have a prosecutor telling you one thing and you have a defense attorney telling you something else, it's not so much common sense. So what you might say tonight is easy. I tell you that if you were sitting in that jury box, I guarantee you would hesitate before making a decision.
Why wasn't there as much interest and support when crack cocaine was epidemic in Wicomico County?
I can tell you from a law enforcement perspective, there was a lot of interest. Crack cocaine came out in 1986. I was a young trooper working down in Calvert County in Prince Frederick. I'll never forget when it first came out. I saw the destruction that crack cocaine was doing to our communities, our counties, our cities, just like I see what heroin's doing today. And I went after them with the same vigor, with the same intensity as I go after them today as Sheriff of Wicomico County. And I said it earlier, and I'll say it again. I don't like any drug of any kind. When we arrest drug dealers and we catch them with large amounts of cocaine, heroin, ecstasy, methamphetamine, we don't see a whole lot of methamphetamine here in Wicomico County. But it is seen in the state of Maryland, particularly out west, and now up in Harford and Cecil counties. But if I have my way, you're convicted of distribution of heroin and cocaine in this county, especially the 3-time losers that we get, I would like to see the death penalty come back. But it's never going to happen in Maryland. It's not going to happen. For those convicted 3 times for distribution of heroin and cocaine, and we have them with regularity, yeah, I would like to see that. But it's not going to happen in Maryland.
With everything being done by the various agencies to address the opioid issues, what do you feel is the highest priority and having the greatest impact?
From my side down here, I feel like education of the public, to let them know what to look for, what to do, and to help us be on top of it. Because obviously a lot of you have firsthand knowledge of it. And, you know, there for the grace of God go I. We all say that, but at the same time, we need your help, and education is the first start. And speaking about education, I want to go a little bit further. Those that have gotten into this trap, and that's what it really is, a lot of times just feel that we've gone through an economy that really has been bad for the last several years, and we're just starting to come out of that now, doing a little bit better. But they have felt like there was nowhere to go, nothing to do. And I want you to know that this year we started a Wicomico Economic Scholarship Program at Warwick a couple years ago, and that was for those coming out of high school graduation. This year I have put forward to the council, and it'll come up for debate sometime, a workforce development. In other words, that I can help people that either want to change their careers or people that don't feel like they've got something. We have a welding school here in Wicomico County, and do you know that every graduate, when they graduate from welding school, is met with a job application for Chesapeake shipbuilders, because there's that much of a need for it. So we have to show people that there is hope. You know, with a little bit of work, they can get there. There's, you know, none of us are going to get it easy. It's not easy in this day and time anyhow. But to show people that there's hope, and going back to college, no longer can you make it on a straight high school education. Even your basic conveyor belts, if we had manufacturing, runs off computers nowadays. So you've got to have some knowledge of that. So, you know, to me, education is one of the biggest things that we can do to help people understand that there is hope for them.
From a health department stance, I think it's the collaboration that is occurring across the agencies that is creating the greatest success, because without that collaboration, I don't think we would be where we are today.
I think partly is the naloxone training, because although it doesn't cure the addiction, it saves the life. And if you save the life, they at least have the opportunity to cure the addiction.
I think the greatest impact we've had so far is dialogue, just what we're doing right now. Dialogue is extremely important in recognizing the issues we have with the opioid addiction, and everybody's willingness to come together and collaborate and have the results that we are seeing here in Wicomico County. Yes, we have had a 24% reduction. I got to tell you, somebody asked a question earlier, is it because of Narcan and naloxone? You bet it is, no question about it. And who cares whether it's a family member using that Narcan, or a law enforcement or EMS professional or a firefighter? We're saving lives with it, and that's what's important.
Talbot County just completed the very successful Talbot Goes Purple campaign. Has anyone from Wicomico reached out to Sheriff Gamble for information on their successful program?
I can answer that. Sheriff Gamble and I were together this morning out at Rocky Gap State Park. We talked about Project Purple months ago, because Wicomico County was the first county to bring Chris Henner of Project Purple to this whole region. He came here to Wicomico County. I personally went and heard him speak at Parkside High School with all of our seniors throughout Wicomico County, and heard him speak out there. The difference with what we did and what Talbot County did is they opted to paint their town and county purple after he left there. We did not do that, but we brought him to Wicomico County to speak to our children. And as you all well know, Joe Gamble is an incredible guy. He's done a phenomenal job. He's a very good friend of mine. And he has done a phenomenal job with addressing the opioid crisis over in Talbot County as well. But Chris Henner was here in Wicomico County less than a year ago We had him at Parkside with all of our seniors and all of our executives came to hear him speak, and quite a good guy he is in starting that Project Purple. Absolutely.
We also, from the opioid intervention team, had the sheriff come down and speak to our opioid intervention team, the treatment and prevention group.
What are you planning to do with the information obtained tonight, and what are the next steps?
We are going to take the information from this forum, put it on our website. Any suggestions that have been made, we're going to take them into account and discuss them during our opioid intervention team strategic planning session. We're going to have additional forums because we know that there are people that could not get here tonight that would love to have an opportunity to hear what's occurring and be able to ask questions. So those are some of the things that we will be doing with this information.
What can we as members of the community do to assist with this epidemic?
Educate. Guard your medication. I can't impress that enough upon you to make sure that you do not leave your medication out for your children to find. And just let people be aware of the problem that is going on, because as many of you are here tonight, and as much as people hear about it, they don't really understand it. And if you're there to answer questions, I think that would go a long way in reducing the stigma attached with addictions issues.
I think just conversation in public whenever you go somewhere. Let's not keep it behind closet doors anymore. Let's bring it out and talk about it and how we can fix it. So you need to talk to your neighbors. You need to talk to your church groups, everybody, and just say it is a problem and we've got to face it. So.
Now the hot seat for everyone. Are you all willing to participate in future community forums strategically held in various parts of the county to obtain input from others in the community?
Yes.
Absolutely.
Absolutely.
Coming to a firehouse near you.
Ladies and gentlemen, I would like to let you know that all of the questions and all of the answers from tonight are going to be posted on the website and available for you to review in case you missed anything. There were some questions that we could not get to because of time's sake. We're going to attempt to answer those and have them available for you as well online. Before we do call it an evening, I'd like to welcome Mr. Culver back to the mic.
Thank you so much again, and again, I appreciate everybody coming out tonight for a subject that's hard to talk about sometimes, but we need to. But tonight, right now, I would like to close with a certificate of appreciation for Jimmy Hoppa to take his time out. We see him every morning. Like I say, we see him every morning. Coming in tonight, Pam, my girlfriend, mentioned to Jimmy that he shares the bedroom with her every morning now. So, like, I know he didn't really want to bring that up, but anyhow, it is true. So we look to him for confidence. We look to him for news. So, and when we have a crisis going on in Wicomico County, he's the one that's up and talking about it on TV. So he's been a great asset for us tonight, as well as Wicomico County in the past with WBOC. So again, our appreciation and gratitude for your helping us.
And by the way, if I want my wife to know what she said about me being in her bedroom, I'll tell her, okay? We would like to thank you for participating this evening. This is an epidemic that we are all dealing with one way or another, and you are the one that makes the difference. Please do not hesitate to contact any of our panelists at any point to ask what more you can do. Is there anything else? Please drive carefully on the way home tonight. Thank you for your commitment and dedication